Good afternoon, those of you who are joining us. We're just going to give some folks a couple more minutes and welcome to Precious Purple Sunday, our fourth annual event. We welcome you and we're going to get started in just a few moments. All right, good afternoon, everyone, and welcome everyone to the fourth annual uh, Be More Healthy Babies, Precious Purple Sunday. We thank all of those of you who are supporting us. Some of you are veterans, you've been with us since day one. Some of you, this may be your first time joining us, and but we just appreciate your support today, and we are looking forward to an afternoon of great information, of great time of sharing. And we certainly also appreciate your patience for us adjusting in the season in which we're in with having dealing with a pandemic. And so we had to do a virtual event this year, but I believe that we're going to still have a great time. I just want to just take opportunity quickly to thank many of our partners here, Hopkins, CCP, Baltimore City Health Department, the Family League of Baltimore City, and I believe also Baltimore Medical System, University of Maryland Medical System are some of our partners at BHB. And we'll introduce some of our panelists and folks that will be with us today. I just want to quickly say that Be More for Healthy Babies is a Baltimore City-led initiative by the Baltimore City Health Department, as I said, with support of the Family League, Baltimore Healthcare Access Maryland, and the BHB brings together communities, organizations, and resources so that every baby might have the best start possible. We envision a future where all of Baltimore's babies are born full-term and ready to thrive in healthy communities, families, and communities. So that just gives you a little bit about us for those of you who are just tuning in. And want to take this opportunity to introduce take a moment to just reflect. And so we're going to get started with our program today. And I want to, as you said, my partner, Angela Burden, who will talk later, we have a monthly roundtable every second Tuesday of every month where we come together. We have many community leaders as well as faith leaders that attend that. And one of our supporters, a faith leader, we're going to have give us a welcome from the community. His name is Brother Darnell Wharton. He is one of the co-conveners of the Baltimore ceasefire movement in Baltimore City. And we want to have him come and welcome you from the community.
Good afternoon, everyone. My name is Darnell K. Wharton. I'm here with you today as a co-organizer of Baltimore Ceasefire 365 and the Community Engagement Coordinator for the Consent Decree Monitoring Team. We're here to celebrate Precious Purple Sunday. More important than all of that, I am a dad. When my daughters were born, they were the most precious creations of God I'd ever seen in my life. And I felt honored to have been chosen with the most incredible task that God has ever given me, and that was to raise and protect the gift that he granted to me. They were so new to the world, and the only people they could rely on to make sure they were safe were my wife and I. failure to keep them protected was not an option. In Baltimore, a Black infant is 2 times more likely to die than a white infant. It is with the utmost importance that as responsible and loving parents, we follow the ABCs of safe sleep for a baby. A baby should always sleep alone. B, a baby should always sleep on their back. C, a baby should always sleep in a crib. And D, don't smoke. Keep smoke away from your baby. No cigarettes, marijuana, or vaping in your home. During the time of COVID, national protests for racial equality, a corrupt government, we have to do all we can to cure the ills that are gripping the nation for our race, such as poverty, homelessness, joblessness, systemic racism, and a lack of viable resources. When the parents and caregivers are adequately prospering as a Black family, the raising of their kids will be more successful. So sit back and virtually celebrate victories with us, recognize the partnerships that we have, and enjoy the dynamic speakers we have to offer. In 2020, let it ring out far and wide that along with the cry of our Black brothers and sisters across the nation that Black Lives Matter, on Precious Purple Sunday, help us yell loud to the heavens so they can hear us say, little Black Lives Matter. Welcome.
Awesome.
Thank you. Awesome. Thank you, Brother Darnell. And we appreciate that. That was an awesome charge and awesome welcome to us. And we thank you for your support and all the great work you do in Baltimore City as well. I want to also take this opportunity real quick, and we can kind of do this impromptu. We can just all maybe, if you want to, just kind of do a quick roll call. I'm not going to call names, but if you want to, I want you to acknowledge like what church you're representing or what organization you're representing this afternoon. We know over the years in our past, we've had about 80 churches, up to 80 churches and institutions and organizations partner with us through this event. And so just take this opportunity. You can all do it at once. I know we're being recorded live, but this is a different kind of event. So just right now, on the count of 3, if you want to just kind of shout out where you're from, who you're representing, what organization you're from, we just want to check in so you can represent so we know about your support representative.
Pastor Holder Grace Baptist Church.
Isaiah Baptist Church.
MSBC.
Baltimore City Health Department.
Church.
Nazarene Baptist Church.
Yay.
Hemingway Temple AME Church.
All right.
New season, new day.
All right.
All right, thank you. Welcome, and we're glad to have all of you with us. And again, some of you are veterans. You've been with us since day one, and we appreciate, once again, your support this year. And as we had to switch gears because of COVID-19, we appreciate your support this year. You can also put it in the chat if you want to. Just put in the chat your church, your organization, that we can have that information recorded if you are shy. Also, so I want to, as we move along this afternoon, I've been quite blessed over the last 2-3 years to have a partner in crime. And she's a very dear person to me, but very well-equipped, well-prepared, professional, as well as minister of the gospel. I want to introduce the Reverend Angela Burden, formerly of the Baltimore City Health Department. She has retired. And I want to also say that although she's retired, she has quite been busy helping and assisting with this initiative. She's also now in her second career, the FEMA record abstractor, as long as assisting with the faith-based initiatives outreach work, which includes this work, Precious Purple Sunday. Reverend Angela Burden is a graduate of the University of Maryland and also St. Mary's Seminary and University. She also serves currently on staff at the New Metropolitan Baptist Church under the leadership of our pastor, Dr. Richard Dickens. And so she brings a wealth of knowledge and information, as well as zeal to this great work that we've been doing. And I look to her as a mentor, although we work together in tandem, because she brings a wealth of knowledge and information. And so without further ado, I present to you this afternoon, Reverend Angela Burden.
Thank you so much, Pastor Dickens, for your kind words and your kindness. We are indeed in partnership together, and this sisterhood and brotherhood in work and ministry has been a blessing in my life, and I appreciate your leadership as well. I greet you all this afternoon in Jesus' joy. I extend to you again the greetings already extended to you, and I'm so glad to have all of you with us this Sunday, Precious Purple Sunday. So I want to say to you, I'm so pleased that you are here and joining us today. And traditionally, I want to say to you, when we think about the work that we have to do in public health, it always seems to say, let's go to the public health institutions. The Baltimore City Health Department should be the one. But what we found is that the health department could not do it alone. There cannot be a change in our city, in our state, and in our country if we don't partner with those in the community, in faith organizations, and all of our community-based organizations. So I want to thank you all for being here, for partnering with us in this work of population-based health. Historically, yes, the health department is the one that you turn to for disease prevention and maternal and child health and immunizations. But we had a crisis in Baltimore City. We had a crisis in 2009 when we faced a maternal and child health major crisis when 27 otherwise healthy babies died while sleeping in Baltimore. And the astonishing number, 88% of them were African American, very preventable deaths. And out of that devastation of the preventable deaths, we launched an effort that we now call Be More for Healthy Babies. So the difference in this public health response was that it couldn't be business as usual. The health department could not improve health disparities and systemic racism alone. As we embarked on the response, we discovered that the problem of infant mortality was far more complex than how a baby is positioned for sleep or having good prenatal care or pediatric care. And it wasn't just about race, but we found it was about racism that was driving all of the disparities that we were seeing. So the burden of racism leads us to physical and psychosocial problems and conditions that are directly linked to poor birth outcomes. Issues such as housing, literacy, mental health, and other social determinants of health, along with systemic racism, surfaced as being at the core of the problem. We had to address these areas in order to reduce infant mortality and the racial disparity that we were seeing in any significant way. And we knew we couldn't do it alone. We needed partners. So the idea came about of forming a collective impact, because paramount to the work of Be More for Healthy Babies was partnering with residents of the community, nonprofits, private organizations, community-based organizations, our faith communities, educational communities, along with implementing evidence-based practices such as home visiting in order to attack the problem. And once we all came together to collectively, we came up with a vision. We envision a future, as Pastor Dickens says, where all of Baltimore's babies are born healthy at a healthy weight, full term, and ready to thrive in healthy families and communities. With that mission, we know that we needed to improve the health before pregnancy. All of the chronic health conditions that women were going into pregnancy with hypertension, diabetes, and mental health and stress. We needed to support families to raise healthy babies, ensure that the quality of the care that they were receiving during pregnancy was the best care and equitable care, and that we needed to promote social and economic justice. And all of this work was woven through the thread of being trauma-informed, anti-racist, and community-driven. And though Be More for Healthy Babies is a citywide effort, extra concentration has been given into two specific communities: our Upton Druid Heights, Promise Heights community, and Patterson Park North and East. And the selection of those neighborhoods was data-driven, as also related to the resources needed and also existing in those neighborhoods. We've made tremendous progress, and we celebrate that today on Precious Purple Sunday. You can celebrate yourselves as our significant partners in making this progress in reducing infant mortality and closing the Black-white disparity. And for that, we are saying thank you, thank you, thank you. Thank you, because 33 fewer babies last year died before their first birthday. We had 33 more babies to live to see their first birthday. But we know even with one death, that's still too much. Our infant mortality rate has been reduced by 35%. Thank you. The Black-white disparity has closed by 64%. Thank you. Teen births are down by 75%. Thank you, partners. Thank you. As well as our sleep-related deaths that launched this effort are down by 71%. I think you ought to stop and give yourselves a hand, because we could not have done this alone. Every partnership matters, and we thank you for the work that you've done. And even as we celebrate all of our faith partners and community partners, our private partners, our educational partners, we know that there's still work to be done. Because even in 2019, we still had 10 sleep-related deaths, very preventable deaths. And 70% of those were to African-American families who are already experiencing tremendous stress and economic disparity. And African-American babies continue to have twice the infant mortality rate of that of white babies. And we also found out that our Black mamas are 4 times more likely to die within 1 year of giving birth compared to any other race. And that is even after you make allowances for education, weight, and economic status. Black women are still dying while giving birth. Black babies are still dying. And so today we're here to say little Black lives matter. This work can't be successful without active involvement, and we need your intentional influence of the faith leaders and our community partners. And so why do you matter? I'm glad you asked me. Why do you matter? You are trusted by your congregations and trusted by the communities. They know you, they trust you. And you are often the first place they go when help is needed. So we have strived hard to make sure that you have the information you need when they come to your door. And most of all, you provide hope. And you reframe their story of whatever loss may have occurred or whatever they are going through. In Jeremiah 29:11, it says, God's plans are not to harm, but to prosper and to give hope and a hopeful future. So when someone comes in contact with the faith community, with our community partners, they gain hope. And we thank you for that. You have influence to encourage healthy lifestyles and linkages to needed services. If you do it, they will do it. If it comes across the pulpit, if it comes through that, they will follow your lead. You care for people holistically, mind, body, and spirit. And studies have found that members turn to their pastors, to their faith leaders with mental health issues before they ever consider counseling or any kind of therapy. You matter in this effort to reduce infant mortality. So this is a collective work that we must continue doing together. We need to decrease infant mortality, mental health, stress, trauma, substance use, good nutrition, obesity, and that parent-child interaction where child abuse and neglect can be reduced because stress is reduced. Decreasing the Black-white disparities and decreasing family abuse and neglect. And we need to increase readiness for kindergarten. Our children need to be ready when it's time to go to school. Everybody, every baby is counting on you. They're counting on me. And they're counting on us to have a collective voice to say that you matter. Little Black lives matter. So Precious Purple Sunday is our annual event to bring attention to all these issues. And we celebrate our successes, we celebrate our partnerships, and we provide you with more information so that we can continue this great work together. And so while nationally we've got lots of attention on Black Lives Matter and racism and systemic racism, we want to make sure that we leave here today knowing that in all of that's going on, little Black lives still matter. Thank you for joining with us this year. Thank you for your partnership. We look forward to continuing our partnership with you, forming new partnership and working together to make Baltimore a better city as we show that little Black lives matter. Thank you so much for being here.
Awesome. Thank you, Reverend Burden. Thank you. Thank you, Reverend Burden. I feel charged. I feel like I'm in church. Amen. If we were in church, we would say every round goes higher and higher because it's only going to get better. But thank you so much, Reverend Burden, for just introducing us and being our BHP spokesperson on today. Awesome, awesome. That's why she is my big sister, y'all. I want to also just take this opportunity. If you have questions, we have an actual spot where it says questions here. Questions here in the chat. There's actually a space for that. And so please, if you have questions as you're going along, we're going to address your questions, attempt to address your questions later on. But please, if you go into the chat, there is a questions here, a selection, and you can just type your question in, and we'll try to certainly answer that later. Are you guys ready for the next preacher? I know it's Sunday and it'll be Sunday afternoon, and she is actually a preacher, and she comes well equipped, and she is our keynote speaker today. Again, there is a section named questions here. Just want to reiterate that. But our keynote speaker for this afternoon is the Reverend Dr. Maxine Reed Vance. She is, I think I'm getting her title right, the Deputy Director at the Baltimore City Healthy Start program. And having serving with her on the fetal infant mortality review, as well as other health strategies and initiatives, not only in the city, but around the state. Reverend Maxine Reed Vance has an abundance of knowledge in this field. And when I just have opportunity to be in meetings with her and hear her speak and watch her, she is passionate about this work and just brings so much knowledge and information and so much talent to this great work. She is also on staff, associate minister, ordained minister at the Grace Baptist Church under the leadership of my friend and brother, Pastor Eric Holder. And so we are looking forward to hearing from her today. And I want to present to some and introduce to others the Reverend Dr. Maxine Reed Vance.
Precious Purple Sunday. Quoting Thomas Paine, "These are the times that try men's souls." Martin Luther King Jr. decried the fierce urgency of now, and Marvin Gaye asked, "What's going on?" Good afternoon and welcome to second service. Please allow me to acknowledge the Faith Community Roundtable and leaders, the Reverend Angela Burton. And let me say that I've known and worked with Angela for almost 30 years, and I really don't need to do any type of address because she has covered it and covered it well. And to the Reverend Meldon Dickens, thank you. Acknowledging the Commissioner of Health, Dr. DeSarasa, the Assistant Commissioner of Maternal Child Health, Rebecca Deneen, and all the partners who make Be More for Healthy Babies work. Recognizing and acknowledge Lachelle Stewart, the Executive Director and my boss at Baltimore Healthy Start, my pastor, the Reverend Eric A. Holder. Precious in the Hebrew scripture means dear, expensive, or costly. Pretty much our definition in English, but there is another association of the word precious in the Hebrew that begs our attention, and that is the word heavy. Perhaps heavy in the sense that for a nation, a culture, a community, and neighborhoods, true health and well-being is determined by the health and well-being of our children. Heavy in the sense that caring for them is a burden we take on joyfully with exceeding hope. Heavy or weighty in the sense that when we fail, there is a heaviness of sorrow and pain. In this city, we fail too often, and we should all feel the heaviness and sorrow and pain and vow to stop the pain. The color purple in the Christian tradition is symbolic of royal status. Our babies represent a royal priesthood. However, let us not forget that even though Jesus was king, he was treated poorly and sentenced to death. Luke 23:11 declares that Herod mocked Jesus and placed him in a purple robe. Purple then too often turns from joy to utter sadness, as our babies are sentenced to death and they are not guilty of anything. Let us vow today to change that. Let your answer be yea and amen. Community, not just doctors and medicine, should rise up and decide that as a collective, we will honor mothers and families and advocate for whatever is needed to make sure we have healthy babies who are allowed to grow and to thrive. A nation that does not care about its children, whether immigrant, indigent, or bondage brought, does not care about the rest of its population. The current pandemic and the lack of a cohesive national policy demonstrates the truth of that very statement. In math, basic arithmetic, we're often required to reduce a fraction to its lowest term. So as I survey the landscape of infant mortality and the disparities in death between two populations, my reduction tells me that it is a problem of love, a void of love. The scientists and researchers out there may say that we cannot measure love. I say we can. For the policymakers who argue that the problem is systemic policies that are in place that create the hostile environment which leads to Black babies dying before they can walk, I say to the policy analysts that those policies stem from a poison root. Basically, what they see is the fruit from a rotten root. The root is void of love. Hence, everything springing from it is deadly. The problem is cultural. You might surmise that we are in a culture of hate and even self-loathing. I would suggest that hate may manifest as apathy and indifference. I believe that what exists against people of color is not apathy and indifference as much as it is purposeful intervention in our lives, which create an environment of sickness that affects and affects our babies even in utero. These infants, when born, carry with them the gestational harm passed to them in utero from the trauma and stress their mothers receive. Nurture can mitigate some of the damage done, and nurturing begins immediately. Providing quality health care, affordable and safe housing, and adequate nutrition, and effective education, and safe neighborhoods is a good start on nurturing our children. Racism has triggered self-hatred. We see and we do not deal with it as people of color in communities of color. There is a disenfranchisement of self. Today, I would like to engage you as community into a conversation about our present. In the church, you often hear that the children are our future, but I submit that they are our present. We have a mandate to care for our children, and it begins with caring for ourselves. We have been under siege in a country that proclaims that all men are created equal, but Black infants die at a rate of 2.5 to 3 times that of their white counterparts. Why is that? Biology tells us that we are genetically similar to other ethnicities. But when we look closer, you see that our physiology has been altered by the stress of racism. Researchers have determined that this stress has increased our inflammatory response and predisposed us to diseases earlier and with more severe negative consequences. I do not have to go any further than COVID-19 and its devastating effect on Black people, who comprise about 40% of the deaths while making up about 13.4% of the US population. A striking disparity about a virus that has no ethnic target. It has been well established that these and other disparities have little to do with genetic variation between white and Black people in America. The question is, if we really want to eliminate disparities, what would it look like? Can it even be done? I firmly believe that the answer is yes. It won't happen overnight, because if the problem is systemic, then it will take a systems approach to solve it. There is a familiar passage of scripture in the book of Exodus describing how a king in Egypt decided to have the boy babies born to Hebrew women killed at birth. Does that sound familiar? He even enlisted the aid of 2 midwives. The midwives did not do as they were told because they feared God more than they feared the king. Right now at church, somebody would have said, amen. Midwives deliver. Under the harsh conditions of systemic racism, we need midwives, calling on community members, faith leaders, lawmakers, colleagues and friends and politicians to deliver our children from community violence, calling on our community members and politicians to deliver our families from police brutality, calling on the powers that be to deliver unto families affordable, safe, and stable housing, calling on our community members and politicians to provide the funding necessary for our children to have appropriate quality education, calling on business leaders and environmental entities to deliver families from toxic environments, deliver us from food deserts where 1 in 5 of our children go to bed hungry every night, deliver us from unemployment and underemployment, deliver us from the evils that precipitate preterm delivery, deliver us from the causes of unsafe sleep and substance use, deliver us from implicit bias in our hospitals and clinics. Deliver us. I'm calling for midwives, community members, faith leaders, lawmakers, colleagues and friends and politicians that will replace fear with faith and deliver us. In these turbulent times, we should teach our mothers and families to advocate for themselves. And I encourage providers to listen to their patients and not to dismiss them because of some stereotypical bias that is held. More broadly, I believe that the currency of culture is goodwill. I need to repeat that. I believe that the currency of culture is goodwill. That is true within a given culture as well as between and among cultures. It is the commodity of goodwill that is lacking. The currency of culture is goodwill. The currency of culture is goodwill. Today, we declare that little Black lives matter. 366 days, we declare that little Black lives matter. Amen and thank you.
Amen. Amen. All right, y'all get y'all praise on. All right, Dr. Wow. 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 That was awesome. Thank you. Thank you. Thank you. Thank you, Dr. Maxine Reed Vance, Reverend Doctor. Amen. We bless you and we thank you. Wow. Goodwill is the currency of culture. That stuck with me. I was putting some things in the chat. This is awesome. This is awesome. This is awesome. And so, wow. If you have any questions or comments at this time, please put them into the questions here in the chat. If you have any questions at this time that we may be able to address, any questions and comments, if you want to connect with us while I'm waiting for your questions to come. As I said, the Clergy and Community Roundtable meets the second Tuesday of every month. We're meeting virtually now at 10 a.m. And we can certainly, we love to have you, love to have your input as we share much information. Earlier when you heard Brother Darnell Wharton speak, but we don't just talk about this issue, but as you heard in Reverend Reed's address, we talk about the food deserts. We've had multiple parts of the health department come and talk to us about smoking cessation, about food deserts, and so many other things. food and nutrition. And so we lift this issue as well as many others that are pertinent to our community. And we're putting information in the chat. And I'm still waiting for questions. I know that was awesome. And so if you like me, I wish I could just sit somewhere and let what was shared with us, actually by both ladies, marinate, because it is, I've been charged a bit. You have rejuvenated me and re-engaged me to be even more courageous in this work, in this effort. Okay, Dr. Reed Vance's comments were powerful. Some folks are writing in the chat. If you want to raise your hand and make comments directly, you can. That we may, I think they can unmute you if you want to raise your hand and make a comment publicly. We welcome you to do that at this time. Again, we want to remind you there are multiple ways that you can also become engaged with BHB. We have, as I said, the Faith and Community Roundtable, but there is also the Community Advisory Board. We have, someone just raised their hand. We also have the Fetal and Infant Mortality Review, and so we certainly would love to have your support here. Someone raised their hand. Can my technical folk give me some help? I guess we'll unmute them so they can comment.
Hello, are you able to hear me?
Yes, good afternoon.
Good afternoon. My name is Marie James. I am a nurse consultant with the Nurse Family Partnership Program, and I have the wonderful opportunity to work with Baltimore City's NFP program under the leadership of Daphne Hicks and Sandra Haskets, and I just was invited to join. I am so excited that this occurred because I think the faith community is crucial and essential to supporting our moms to be able to renew them, to restore them, and to rejuvenate them. Our moms are working in today's society and culture is so stressful, and then layer on with that is the systemic racism, as you mentioned. So there needs to be a safe place. And I think the faith community can be that place. But one thing I would encourage is that we sometimes can come off a little hoity-toity or judgmental. So it's so crucial what the doctor shared earlier about listening, you know what I mean? And being able to hear our moms and let them see Jesus through us and the love that we share to them, and support them in making different decisions that can impact their life with the support of the wonderful resources that are available through Be More for Healthy Babies. So I just want to take the time to say thank you for hosting this. I hope there are more opportunities to get the faith community involved, whether it be through support things like diaper drives, because resources, as we know right now, are very hard. Some people have lost their jobs, whether it be food cupboards and things like this that are concrete. I believe in prayer, and prayer is essential and powerful, but behind that prayer, we need action as well. So how can we really put our mouths, our voices, and our resources back into the community to be a support to our moms? So thank you for the opportunity to share my thoughts.
Thank you. We appreciate that. That is awesome. Thank you for just your support and your kind words of encouragement. And certainly we welcome you, your faith institution or community partners to be a part of this great initiative. Are there any other questions or comments? Folks are saying amen. Your pastor, Dr. Reed Vance says, what a word, what a word. Stacy Stevens, the director of Hopkins, said, deliver us. Yes, deliver us. That was awesome. I just want to say, as a preacher, I got about 3 or 4 sermons out of that. And so I will be giving you credit when I use them and preach those topics. Goodwill, that culture piece, I'm using that. So yes. Okay. Also, if you guys could take a picture, those of you have on your purple, and post them or share it on your social media. and use the Precious Purple Sunday hashtag and Little Black Lives Matter hashtag. So those of you who took pictures, I don't know if you took them at your church or even if you're wearing your purple now, please take a picture, put it on your social media, that's your Instagram, Facebook, with the hashtag Precious Purple Sunday or Precious Purple Sunday. Hashtag Little Black Lives Matter. Are there any other questions or comments? Again, also, I want to share with you, you can visit us on our website. This is in the chat to find ways to get involved. That is www.healthybabiesbaltimore.com. Again, www.healthybabiesbaltimore.com. I'm getting. And also, if you want to put a video on, we can get a screen grab if you use the hashtag as well.
Pastor Dickens, this is Reverend Burden.
Yes, how are you?
Hi, I'm well. Thank you, everyone. Again, I want to say this has been marvelous to have this virtual event. You know, usually we are in our individual places of worship and we're sharing maybe pictures, but being able to be on this platform together has been a blessing. So I think even after the pandemic is over and we're able to go back to brick and mortar, I think having this online platform is still a blessing so that we can have our visitors and our friends even far away. Thank you so much to the nurse family partner, Miss Marie, for joining us even outside of Baltimore City. So I appreciate that. And I just want to say, as we look at Little Black Lives Matter, we've got a time in history right now where we've got so much going on that we've got to think about holistically what we need to communicate as people of faith, as private institutions, as community partners. Vote, 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 vote.
Yes.
We need to vote. Absolutely vote.
Yes.
We can't just protest. We can't just walk. We can't just march. If you want to cause some good trouble, get into some good trouble, vote, vote, vote. And I know that faith institutions are working right now to figure out if they need to carry ballots in for people, if they need to pick people up who want to go face to face. So we want to make sure that you vote, vote, vote. And the other thing is, we know that with COVID-19, it has disproportionately affected our community, just as infant mortality. We are dying disproportionately of this condition and this disease. And as we go into the flu season, Dr. Reed Vance will acknowledge this as also being a nurse, and I'm a nurse. We're in flu season, and the symptoms are going to look very similar. So you want to get your flu vaccine. They are free of cost. The health department has locations that you can go to your local pharmacies, your local urgent care places. Get your flu vaccine. You don't want to have flu and then also run the risk of COVID because then we're putting ourselves in great, great dire risk. So as a community, we've got a message that all comes together because pregnant women need the flu vaccine so that they are well and can give birth to healthy babies. And babies and children, as they're going to school and being exposed, bringing it back home to their grandparents and other vulnerable communities. So we need to make sure that we are getting immunized with, vaccinated, with the flu vaccine as it's available, and making sure that we vote, vote, vote. All of that says to us that Little Black Lives Matter. It's not just one thing, it's all those things. Thank you, Pastor Dickens.
Yes, thank you. And certainly we want to, I didn't. Thank you, Dr. Morton, for your support. Hemingway has been a great support of us over the years. We appreciate you so much, Aunt Joan. Please, everyone, if for a second you could just turn on your cameras one more time. We just want to do a screen grab to showcase the webinar participants. So if you could please just real quickly turn on your cameras. We want to just do a screen grab of you that we might be able to record and document you being on our first virtual event. This is our 4th annual, This is our first virtual event. It's funny, we got a couple texts about that as well, Reverend Burton, that we should continue this virtual way of connecting. So we're blessed, and hopefully that you all got something positive out of now. Our time is drawing near, but I want to certainly just give you one more opportunity to ask a question, to put a comment in the chat. Again, it should go to questions here. There's a section designated questions here. If you have a question or comment, once again, thank you so much, everyone who's participated, all the team that's behind the scenes. I want to do that now because we might omit someone, and I'm not going to call names. You folks know who you are. You know you are certainly great to me. Yes, I want to support you, give you a hand of applause, all the technical people behind the scenes, CCP Family League, the Baltimore City Health Department, all of our partners, HCAM. And so we really, really appreciate you and your work. And so, again, thank you for your support. And I want to also just take this time to thank our brother Darnell Wharton from the ceasefire and the consent decree monitoring team. Thank you, sir, for your continued support, always attending the meetings, always supporting our work and promoting our initiative. Reverend Angela Burton, thank you so much. Did a fantastic job of being our VHB spokesperson on this afternoon. An awesome job. We just commend you. We couldn't have picked a better keynote speaker. So Reverend Dr. Reed Vance, we bless you and thank you for your work today and your work. And so someone said, I claimed that this event was going to be wonderful. Yes, Daphne. Thank you, Ms. Hicks. Thank you again for your support as well. And so, one more time, going once, going twice. Y'all don't want me to get Baptist and say if all hearts and minds are clear. I know we in church. Okay, I got another chat.
Thank you, Nurse Family Partnership.
Yes,
is in the
thank
house.
you.
You see that?
Yes, we appreciate that. And
Thank
so
you.
we just, we appreciate, we want to lift this up. And also we want to share this there. I didn't mention this. We do have an anti-racist work group that specifically is a part of a coalition of all of the organizations, as well as others that we are working with that lead some of this anti-racist work. We really, and I commend the health department and all of the partners, Family League and all the other partners, Hopkins, CCP, that are supporting this effort to try to think about how we practice and how we do the work that we do to make sure we do it in an anti-racist manner. So we certainly, that'd be another opportunity for you community leaders to be involved, and that's a monthly meeting as well. So we just have many opportunities for you. And I really want to say this, we want and need you at the table. And that's really how I became involved. And at this point, now I'm a part, it's also in my DNA. This work is in my DNA now. But that's kind of how I became involved, just coming to a meeting and being exposed to the work. And once you discover some of the things that we don't know that are so readily apparent or readily that's going on around us, it has to touch your heart.
Hi, this is James again. I just needed to clarify something. I noticed that someone said that I wonder why institutions like CDC and NFP shy away from stating racism as the primary cause of infant and maternal mortality, and how as the faith community can bring this to light collectively. I just want to clarify that Nurse Family Partnership at the National Service Office level, we are on top of this. We have developed a maternal mortality coalition, and we are looking at racism and also working to develop facilitators and teaching materials to support our nurse home visitors to engage in these conversations with our with our moms. So I am more than happy if someone will connect with Daphne Hicks, who is the NFP administrator. I will send her all the materials that she can then share with the faith community what the Nurse Family Partnership National Service Office is doing in regards to racism and also the inequality that's impacting women of color. We have so many initiatives that we're working on right now. We have some fact sheets. I have a whole slew of information. So please note that that Nurse Family Partnership is definitely in the arena, and we are raising our voice in partnership with other institutions as well. Thank you.
Thank you again. All right. Well, I'm charged to end the event with a prayer or benediction as they have on the program. I'm going to close out in prayer this afternoon. Gracious God, we thank you, and we thank you for this opportunity. We thank you for us coming together in this fourth annual Precious Purple Sunday event. We thank you for this first virtual event. And so all of the speakers and everyone who participated, everyone who came on, who commented, who questioned, those who just came in to listen, certainly we thank you for them. Continue to give us the strength and the idea, the zeal to continue to do this great work, to touch and save those, to advocate for those who are less fortunate than us, those who are most vulnerable amongst us, those families in our Baltimore City community, and continue, God, to give us vision and direction to be More Healthy Babies, a leading organization with leading and best practices for this great anti-racist work. Thank you, God, for all the participants today and for everything that we've experienced. In Jesus' name we pray. Together we say, amen.
Amen. Amen.
Thank you, everyone. Again, thank you, everyone. We appreciate all of your support, and we'll share any information with you. You can go to the BHB website. On BHB, we have Facebook and Instagram. So there's many ways that you can connect with us, get information. Again, we thank you, all of the churches that are part of our clergy roundtable. I want to thank everyone. This has been a great, great, great event. Thank you so much for your support.
Thank you.
Thank you, guys. Thank you. Thank you.
Thanks, everyone. Have a great Sunday.
Thank you. Thank you, everyone.
Thank
Enjoy
you,
the rest of your day. Thank you. Thank you, everyone. Thank you.
Thank you. Thank you. To my team, well, not my team, but the team, thank you. Thank you. Thank you. Thank you.
Thank you, Pastor
April,
Dickens.
Amber, Tina, Paula, and CCP is my home, away from home, my family. Family League, Health Department, HCAM, Reverend Burden, Reverend Maxie Vance, all of those for supporting us. We thank you. Grace Baptist Church, we shout you out. Nazarene Baptist Church, been two of our more faithful partners. Thank you so much. Thank you so much for all of your work, all of your commitment. We really appreciate you.
Amen.